The ancient Romans were, by most measures, a remarkably sophisticated civilization. They built aqueducts that delivered clean water across hundreds of miles. They invented concrete. They constructed roads so well engineered that some are still in use today. And every morning, they rinsed their mouths with urine. Not by accident, not out of desperation, deliberately, as part of a considered, widely practiced dental hygiene routine that persisted for centuries across the Roman world. The question is not just why, though that is worth asking. The question is whether it actually worked. Because the answer, as it turns out, is more complicated than most people expect. And once you understand the chemistry involved, you may find yourself with a slightly uncomfortable new appreciation for the Romans, and a slightly different perspective on your own bathroom cabinet. To be precise about what the Romans were doing, we need to talk about what dental hygiene looked like in the ancient world more broadly. The Romans did not have toothbrushes in any modern sense. They cleaned their teeth using a combination of methods: rough cloths or small sticks to physically scrub the teeth, and various powders and pastes to help with whitening and freshening. These tooth powders, called dentifricium, were made from a surprising range of ingredients: ground oyster shells, pumice stone, the ashes of burned animal bones, eggshell powder, dried iris flowers, bark, and urine, both human and animal, with Portuguese urine apparently considered the most effective, imported specifically for this purpose. The Roman poet Catullus even mocked a man named Ignatius for his unnervingly white teeth, suggesting the only explanation for such brightness was that he had been very diligent with his urine rinse. It was, in other words, a known and publicly acknowledged practice, not some fringe behavior confined to the desperate or the eccentric. Here is where the story stops being merely interesting and starts being genuinely surprising. Urine contains urea, and urea, when it breaks down, produces ammonia. Ammonia is a base, meaning it is alkaline, and alkaline substances are highly effective at breaking down acidic compounds. The bacteria in your mouth produce acid as a byproduct of feeding on sugars and food particles. That acid is what erodes tooth enamel and causes decay. An alkaline rinse neutralizes that acid. It does not kill the bacteria directly, but it disrupts the acidic environment those bacteria need to damage teeth. This is not folk medicine. This is chemistry, and it is the same basic principle behind many modern mouthwashes, which use alkaline compounds to neutralize oral acidity and disrupt bacterial activity. The Romans did not know any of this, of course. They had no concept of pH, no understanding of bacteria, no knowledge of how tooth decay actually worked at a chemical level. But through observation and trial and error over generations, they had stumbled onto something that was, in chemical terms, genuinely effective. So did it work? The honest answer is, partially, and with significant caveats. The alkaline properties of ammonia would have provided some genuine protection against acid erosion. As a neutralizing agent for oral acidity, it was chemically sound. However, urine does not contain fluoride, the compound that modern dentistry considers most critical for strengthening tooth enamel and actively reversing early decay. And urine contains no antibacterial agents capable of killing the bacteria, causing decay in the first place. It neutralizes the acid those bacteria produce, but it does not address the source. Archaeological evidence supports a mixed picture. Roman skeletal remains show relatively low rates of cavities compared to medieval populations, but researchers attribute this primarily to the Roman diet, which was lower in refined sugar than later European diets. Romans ate far less sugar than we do, which meant less bacterial acid production to neutralize in the first place. The urine rinse almost certainly helped at the margins. But the cleaner Roman teeth were mostly a function of what Romans were not eating, rather than what they were rinsing with. It is worth noting that the Romans were far from alone in this practice. Ancient Greeks used urine for oral hygiene. the Egyptians used it in various medicinal preparations. In parts of ancient India, urine was considered a purifying substance with broad medical applications, a belief that persisted in certain traditions for centuries. In Europe, urine-based mouthwashes were still being recommended by physicians well into the 17th and 18th centuries, long after the fall of Rome, long after the Renaissance, and not far removed from the beginnings of modern science. The French used urine to treat skin conditions. The Portuguese, as mentioned, exported it as a dental product. And across many cultures, the ammonia content of aged or fermented urine was used in textile production as a cleaning agent for wool, which required collecting it from public latrines in industrial quantities. We tend to assume that history moves cleanly from primitive to sophisticated. The story of urine in medicine and hygiene is a useful reminder that the line between those two categories has always been blurrier than we like to think. The history of dental hygiene is, in many ways, the history of humans slowly discovering the right answers through the wrong methods. The Romans understood that something about their oral rinse was working, even if they attributed it to purification or divine favor rather than chemistry. The Egyptians understood that abrasive powders could clean teeth, even if ground animal bones are a far cry from the precisely calibrated abrasives in modern toothpaste. The fundamental insight that the mouth requires active maintenance, that left to itself it will decay, and that certain substances can slow or prevent that decay, is not a modern insight. It is ancient. Modern toothpaste was only standardized in the 20th century. Fluoride was only added to toothpaste in 1914 and only widely adopted after the 1950s. The electric toothbrush was invented in 1954. For most of human history, for the overwhelming majority of the time that humans have had teeth, people were working with whatever chemistry they could find, test, and pass down. Sometimes that chemistry happened to involve a substance we now find repulsive. Sometimes it worked anyway. The next time you stand at your bathroom sink, toothbrush in hand, with a perfectly calibrated fluoride paste in a precisely engineered dispenser, it is worth pausing for a moment to consider the journey that got you there. Thousands of years of accumulated human observation. Generations of people noticing what worked and what did not. Physicians recommending, patients experimenting, empires trading in substances that we would not go near today. The Romans were not foolish. They were observant. They noticed that something about their dental routine produced results, and they passed that knowledge on. The fact that they were right for the wrong reasons does not diminish the intelligence behind the observation. In fact, it is a reminder of something worth holding on to, that human beings have always been trying to figure things out with whatever tools and knowledge are available to them, and that the gap between us and our ancestors is mostly a matter of information, not intelligence. They had the same minds we have. They just had less to work with. Thanks for watching Quiet Atom. Subscribe and stay curious.